Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chipana.
Good evening and thank you for joining us for another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy in Sicklerville, Woodbury, Washington Township, and coming soon to Pennsville. We are live for the next half hour. We're talking about low back pain, neck pain, and also taking your calls. Tonight you can reach us with your question at 1-888-634-7488. Also locally 856-767-8884. If you prefer to email a question to us, you may do so. Our email address is wpsjtv@aol.com. Later on in the program, we'll give you numbers to call Cross Keys Physical Therapy directly and schedule your appointment for a free evaluation. We'll tell you more about that free evaluation offer at the end of the program. Right now, though, let's meet our guests here tonight to answer your questions. First of all, we have Dr. Lawrence Deutsch, who is an adult and pediatric spine surgeon, specializes in pediatric orthopedic surgery, adult and pediatric scoliosis, spine surgery, and he's with orthopedic and neurosurgical specialist in Haddonfield and Vineland. And next to him is Dave Anselmo, who is a physical therapist with Cross Keys Physical Therapy, again in Sicklerville, Woodbury, and Washington Township. Welcome to the program, gentlemen.
Thank you.
And Dr. Deutsch, we'll start with you. Give us a little background on you and your, the type of surgery you do.
Okay. Well, I'm an orthopedic surgeon. I trained at Columbia Presbyterian Medical Center in New York City, and up until recently, I was part of the faculty at Cooper Hospital. I was the head of the spine service and head of pediatric orthopedics for the last 10 years. I do primarily adult and pediatric spine. I do scoliosis in children. In adults, I do everything from the base of the skull down to the sacrum, anterior, posterior surgeries, cervical, thoracic, lumbar. We do trauma, degenerative diseases such as disc herniations and tumors, infections, pretty much the whole gamut.
Quite a background. And you can reach us with questions about low back pain, neck pain, 1-888-634-7488. Our first caller is on the line from Philadelphia, Jarrett. Welcome to Sports Doctor. Are you there, Jarrett?
How are you?
Good. How are you?
Good. About 6 years ago, at it's an old sports industry, I turned my back, and I was in a car accident about 6 months ago. And just lately, my lower back has been, bothering me. He said it's like my coccyx bone near the tailbone. Mm-hmm. And I just want to know, is there some kind of therapy or something I could do?
Okay, it's kind of a general question and certainly difficult to answer without seeing this person. But do you have any thoughts for the caller?
Well, there's not a lot of therapy you can do for the coccyx. I don't know if you have any feelings about that.
No, I agree with you. I recommend you basically to go in and see your physician and get checked out to see what really is the coccyx.
The coccyx is the small bone that comes off the sacrum. There is a joint there, and it could be fractured or subluxed, and it could be very painful. In most cases, it will heal by itself. We make the patient more comfortable by giving them a donut ring to sit on. Mm-hmm. If it persists, you can try injections around that area to settle it down. In the worst case scenario, if it continues, you can actually excise that bone, and patients can do quite well with that, although it's in an area where infections are certainly a risk.
Is that more commonly known as the tailbone?
Well, it's part of the tailbone. People frequently refer to the sacrum as the tailbone, but this is actually a remnant of a tail. At one point, we had tails.
Evolution. Thank you for the call, Jarrett. Our next caller is from Sewell. Marie, are you there?
Yeah, I'm here.
Hi, thank you for calling. Your question tonight.
Yes, I have deteriorating disc in the back of my neck, and I went to 3 different doctors, and they're talking about going in and having them fused, And I was wondering, do you do anything like that, or is it feasible to have that done with the arthritis and that I'm suffering in my neck and down my spine?
Okay, a fuse question.
Absolutely, it's feasible. The question is, have you first explored all other options? If there's no danger to the spinal cord, if we're not concerned about paralysis and it's primarily pain, then you have to, it's advisable first to go through all kinds of conservative management to try to avoid surgery. Surgery has risks. Although the great majority of people do well with surgery, the ideal patient for surgery is a patient who has a single disc that's very bad and the rest of the spine looks great. So you would want to try physical therapy, anti-inflammatory medications, give this time, don't jump into anything quickly. With therapy, there's traction, ultrasound. Well, Dave, you might have some comments about that.
There's a lot of things you could do with that type of symptoms, like of course there's Morse, electrical stim, cervical traction, like he mentioned, ultrasound. All these things will help to alleviate some of your symptoms. Ultimately, that might be your best route to do. Like he said, you want to exacerbate all your conservative options before you go into doing something like surgery, even though, like the doctor said, if it's absolutely necessary, it's highly successful.
Okay.
Just one other thing, after the therapy, if that is not successful, there are other modalities such as injections, epidural steroid injections, selective nerve root blocks, and then again, surgery, and we're going to be talking a little bit more about surgery later on.
Okay, lots of people with problems with the back and neck areas. We didn't even get through Dr. Deutsch's introduction, and people started calling already, and that's fine. Our toll-free number is 1-888-634-7488. You're watching Sports Doctor, brought to you by Cross Keys Physical Therapy. Our next caller is Steve from Lafayette, Pennsylvania. Steve, are you there?
Yes.
Hi, what can we do for you?
2 weeks ago, I ruptured my bicep tendon, and I've had 3 different opinions. One was to fix it right away, and the other 2 were that I should only fix it if I was an athlete, and I would only lose 10% of the strength in my arm. Do you have any opinion on that?
A torn bicep.
It's not really my field. I have a partner who does upper extremity work, but it depends on if it's the distal biceps or the proximal biceps. The one in the shoulder, since there are 2 heads of the biceps tendon, they frequently don't repair that. If it's the distal one, in most cases they do repair it. But again, that's not my field.
Thank you for the call, though. Thank you for watching Sports Doctor, brought to you by Cross Keys Physical Therapy, Sports Medicine Center, Sicklerville, Woodbury, Washington Township, coming soon to Pennsville, offering free evaluations for the next 2 weeks. We'll give you numbers for that at the end of the program. Dr. Deutsch is with us. He is a spine surgeon with orthopedic and neurosurgical specialist in Haddonfield and Vineland, and also Dave Anselmo, a physical therapist from Cross Keys Physical Therapy. You can call us with your comments, questions, 1-888-634-7488. Our next caller is from Gloucester County, and I don't believe I have the caller's name. It's Debbie. Debbie, are you there?
Yes, I am. Thank you. How you doing?
Good. How are you, Debbie?
I have a very interesting, very important question to ask you. I was sitting here flicking through the channel and saw your show on. I've been having leg pain, knee pain, and calf pain for over a year. I've had numerous studies done, and they still can't figure out exactly what it is that's wrong with my leg. They seem to think that it's possibly coming from my back only because I had a long-acting anesthesia block done to the L4 spine, in my spine, and I didn't have any leg pain for like 10 hours. There was no cortisone injection or anything, but I don't have back pain. And I've already had 2 MRIs and an MRI of my calf, and nothing is showing up. But my whole leg keeps swelling, and I have constant pain for over a year. and I'm just like spinning wheels. I've been to numerous doctors, and they just can't figure out what exactly is wrong, and they keep saying that possibly from my back, but they can't find anything.
An interesting
So I was
question.
wondering if maybe you guys have any opinion.
Could I just ask you, did you have a bone scan, a total body bone scan at any point, or an MRI of your low back?
I had an MRI of my low back, and it just showed that I had a little bit of arthritis.
Okay.
But no herniated disc or anything like that. Nothing was hitting on the nerve.
All right. A bone scan could be useful too to see if you have any abnormal findings in your extremity. Another useful diagnostic tool is the EMG nerve conduction study to tell us if any of your nerves are abnormal. If we can localize by exam or by a study such as that, a particular nerve that is malfunctioning, we could then try a selective nerve root block or an epidural steroid injection. If that is injected in your back and you get relief in your leg, even if it's temporary, it can indicate that the problem is coming from the back. Even though they don't see anything pressing up against your nerve, you have to understand that the studies are imperfect. The spine is also mobile. It may not be touching anything in that static picture that they take when you're lying down, but when you're moving, you may be hitting it. So that's where I would start to try to evaluate you. If another tool is the discogram. If you inject a number of discs and they give you, a normal disc should give you no pain. Degenerative disc might give you pain. If it's different from your normal pain, it's not that significant. But if they inject the disc and it gives you exact reproduction of your pain, it's a good indication that that's the level where your problem might be coming from.
And I know that's one of the things you want to talk about later in the program is new advances in the diagnosis of back and neck pain and also the future of spine surgery. And hopefully we'll get to that. Dr. Deutsch is with us, available for your calls, 1-888-634-7488. Heather is our next caller. She's calling us from Philly. Heather, welcome to Sports Doctor. Heather, go right ahead with your question.
Doctor, I'm curious as to why you are entertaining such open-ended questions that are impossible to answer on television. It's just,
well,
and I just can't.
Well, Heather, we open up the phone lines and we see what comes in, and I think the doctor is being fair.
We're just trying to give information based on a particular subject. We know that we're not seeing that particular individual. We know that we can't know their specific case, and certainly this is very broad advice and not more information than advice. If a person has a significant problem, they certainly should go through the normal route of seeing their primary care physician, and if they feel it's appropriate, being referred to a specialist.
But Heather, you bring up a good point, and Cross Keys Physical Therapy is offering free evaluations for the next 2 weeks, and at the end of the program, we'll give you the number for Cross Keys to schedule your appointment. Right now, though, 1-888-634-7488, the number to reach us with your question. We're talking low back pain, neck pain. It's Sports Doctor. More of our program right after this.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
Oh, you're lucky, young fella. You know, hospitals didn't even use ether for your procedure until about 1846. Yeah, slap on a few live leeches, grab a hacksaw, get to work. Of course, we don't use leeches anymore.
It's fun to know history. Find curious facts from America's past at loc.gov, the Library of Congress website.
Okay, welcome back to Sports Doctor. Again, we're here every other Thursday night at 9. We're brought to you by Cross Keys Physical Therapy. They're located in Sicklerville, Woodbury, Washington Township, coming soon to Pennsville, and they're offering free evaluations for the next 2 weeks. We'll give you the numbers for that at the end of the program. Tonight, to answer your questions about low back pain, neck pain, we have Dr. Lawrence Deutsch with us, who is a spine and orthopedic surgeon with orthopedic and neurosurgical specialist in Haddonfield and Vineland, and you specialize in both adult and pediatric. And also with him is David Anselmo, who is a physical therapist from Cross Keys Physical Therapy. With us on the line right now is Mike from, was it Haddonfield? Pennsauken, I'm sorry. Mike, welcome to Sports Doctor. Is Mike there?
Yes.
Okay, go right ahead with your question.
Yeah. Yeah, Doc, I have a question for the surgeons there. About 25 years ago, I had a severe back problem. I had pain down my, the sciatic pain down the back of the leg. I had was diagnosed with a couple herniated discs. They took a myelogram and found this out. When the surgeon got in, I went to a neurosurgeon. When he got into my back, because there was no MRIs in those days, when he finally got in there, here I had spinal stenosis. It was considered moderate to severe. Now, what they did was they did an unroofing laminectomy around L5-S1 and L3-L4. Now, when they, the surgeon now, this was a while ago, he's passed away, and I have some questions now. Every once in a while, if I move certain ways or whatever, it feels like I'm, pulling a muscle or something. I'm wondering if, when they do the unroofing laminectomy, are some of those tendons and ligaments actually displaced or taken off the bone, and does this actually cause some of the restriction in the back?
Okay.
Well, when we unroof the bone with spinal stenosis, we're trying to decompress the canal where it's become tight around the nerves. It's not so much that restricts the spine, it's more that you probably have gone on to develop more arthritis, and as a result, there's less mobility. The other thing that can happen sometimes if through arthritis or sometimes with too aggressive a decompression is you can sublux, and then the vertebra might not be perfectly aligned. You probably need to have new studies, but it sounds like you're not doing too badly after 25 years after decompression.
Is that procedure still performed today?
Yes. Oh, yeah. Very, very often. Especially in elderly, as they develop arthritis, it builds up around the nerves and causes the bone builds up around the nerves and causes this compression. Some people are born with a congenital stenosis. But it's actually a very successful operation. In most cases, people have this neurogenic claudication where as they walk, their legs become heavy. They feel like lead. They get this burning sensation and numbness. And very often with this decompression, they have very nice relief of these symptoms.
Okay, another caller on the line, this time from Pittman. Pat, welcome to Sports Doctor. Are you there, Pat?
Yes.
What can we do for you tonight?
Yes, I am. I've been having a lot of hip pain and some minor low back pain, and when the results from my MRI of my hip and pelvis actually showed a Tarlov cyst, and I'm not familiar with that, and I'm having difficulty finding information about it. Can you give me some information about that?
You shook your head, so I take it you're familiar with this.
Yes, yes. Tarlov cyst is an outpouching of the meninges, the lining around the nerves, into an area around the nerve. It contains cerebrospinal fluid, and in most cases it really has no significance. Chances are your problem is more related to disc being damaged, degenerative, some arthritis, but the cyst itself is probably very benign. In most cases it is.
Okay, thank you for watching. Thank you for the phone calls. Getting some interesting topics tonight. And you can call us with your questions about low back pain, neck pain. 1-888-634-7488. It's Sports Doctor, brought to you by Cross Keys Physical Therapy. Next caller, Carol from New Jersey. Carol, how are you tonight?
Yes, hi. I have a question for the doctor, please.
Go. Did we lose her? Okay. Let's put out the phone number again. It's 1-888-634-7488. Now, you're an orthopedic surgeon, Dr. Deutsch. What's the difference between an orthopedic surgeon and a neurosurgeon?
Well, orthopedic surgery is the surgery and medicine of the spine and the extremities. Neurosurgery is the head and the spine, so we overlap. All orthopedic surgeons and all neurosurgeons are trained in spine management and surgery. But most general orthopedists and general neurosurgeons are not spine specialists. Very often we have additional training to become spine specialists. I know neurosurgeons who rarely do anything more than a simple disc. My partner is a neurosurgeon, Dr. Testiuti, is also a spine specialist, and we actually, it's very similar. The work that he does and the work that I do are virtually identical in the spine. Neurosurgeons have a little bit more training in intrathecal tumors, which is tumors within the spinal cord itself, where we, and I do many tumors that involve the outside of the spinal cord. Orthopedists have a little bit more training in scoliosis, the deformity that children develop and sometimes adults.
Okay, and Dr. Deutsch is with us from orthopedic and neurosurgical specialist in Haddonfield and Vineland. Also Dave Anselmo with us from Cross Keys Physical Therapy. We're ready for another break. You can reach us toll free with your questions tonight at 1-888-634-7488. More of Sports Doctor right after this.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
It is more than a trial by fire. It is a rite of passage. And if you can master your fear, outsmart your enemy, and never yield, even to yourself, you will be changed forever. The few, the proud, the Marines.
Thank you for joining us for Sports Doctor. We're here every other Thursday night at 9, and at the end of the program, we're going to give you numbers to take advantage of the free evaluation offer from Cross Keys Physical Therapy. They're in Sicklerville, Woodbury, Washington Township, coming soon to Pennsville. Dave Anselmo is with us from Cross Keys. He's a physical therapist there, and also Dr. Lawrence Deutsch, who is an orthopedic and a spine surgeon, specializing in adult and pediatric surgery. He is with orthopedic and neurosurgical specialist in Haddonfield and Vineland. You can reach us toll free right now with your question, 1-888-634-7488. Talking about back pain, we have Rochelle on the line from Philly. Rochelle, welcome to Sports Doctor.
Hi, how are you?
Good.
I have my MRI report in front of me for both my lower back and my neck. But I'm mostly concerned about my neck because when I went to my doctor on Monday, He told me the neck was very, very bad, and he gave me the number and name of a surgeon to go to. I'm afraid of the surgery. There's a couple of words, I don't want to take up too much of your time, on the MRI report for my neck. I also have the other one for my lumbar with the degenerative discs. But the one on my neck, it says, for instance, a reversal of lateral cervical lordotic curve with an advanced degenerative disease, disc disease at C4 and 5 and C5 and 6 with spondylosis. I want to know what lordotic curve is.
Okay. We're going to use the model for this one.
Sure. If you look at the spine from the side, we have two curves, three curves actually. A curve forward, a curve backwards, and a curve forward. This is lordosis, this is kyphosis, this is lordosis. Our neck is supposed to gently curve in this direction. Sometimes with arthritis or trauma, it bends forward. Now, ma'am, are you still on the line? Okay.
I don't think we have.
Well, the thing is, you have arthritis there, and if you are older, the fact of the matter is we all get that, and what you're describing is so common that I wouldn't be terribly alarmed from what you're reading. I think you should see somebody who is knowledgeable in this to look at the films and make sure, and more importantly, look at you. I've seen people with horrendous looking films that were just fine. I've seen people who had normal films who were in agony. The most important thing is to make sure that your spinal cord is normal, and if you're walking normal and you have no numbness, no tingling, no problems with bowel and bladder control, you're probably, you know.
Okay, we're going to have to stop there, unfortunately, Dr. Deutsch, because we are out of time. But before we go, we want to give you the numbers to take advantage of the free evaluation offer from Cross Keys Physical Therapy. All you have to do is schedule an appointment. You may do so by calling the center nearest you. In Circularville, it is 856-728-1900. Woodbury, 856-853-0988. And in Washington Township, it is 856-374-3707. And don't forget, for you folks in Pennsville, they're coming soon to a location in Pennsville. I want to thank Dr. Deutsch for joining us tonight. Again, he is with orthopedic and neurosurgical specialist in Haddonfield and Vineland, and also Dave Anselmo from Cross Keys Physical Therapy. Again, thank you for joining us. We'll be back 2 weeks from tonight with another edition of Sports Doctor. Until then, I'm Joe Chapana. Stay well.